I'm Alistair Kent. I'm the Director of the Genetic Alliance UK, which is an alliance of patient organisations for those affected by all forms of genetic disorder. In this project, I was responsible for the working group that addressed patients' interests and concerns with a view to finding out what the real issues are that people who are likely to be the ultimate end users of nanotechnology in medicine are, and how they feel about the research and development that's taking place and that's likely to take place in the future. I think probably two most important points are, first of all, that there is a widespread lack of awareness amongst patients and amongst families of what's happening in nanomedicine, but that once that's explained, once they realise what's going on, what the potential is, there is general support. They see this as a promising line of investigation, and of course, although in many cases it's still research and may not deliver, patients and families are generally keen to see the research supported and the investment sustained in order that this can be properly explored and hopefully deliver effective interventions for currently unmet health needs. And the second, I think, main conclusion that we reached is that for patients and families, it's not about process, it's about outcome. Patients and families want effective interventions. They want things that change the course of their disease for the better, that improve the quality and the quantity of their life. And they want these delivered in a timely, a safe and an effective way. Ultimately, nanomedicine or nanotechnology in medicine is a route to that aim rather than a goal in itself. And for patients, if it does what it says on the tin, if it does it in a safe way and it doesn't have too many adverse, unexpected consequences, then basically they'll support it. And that doesn't matter whether it's nanotechnology, gene technology, conventional pharmaceuticals, or anything else. I don't think that there is a deliberate attempt to cover up or conceal the fact that nanotechnology is involved in the production of new medicines. I think it is more that there is a kind of lack of awareness of, in a sense, how little people know and how potentially supportive they can be if they appreciate what's actually going on. It's about it being open, it's about explaining to people what you're doing, but it's also about listening to any concerns and anxieties that people have, treating them seriously, even if, as an expert, you know that that particular anxiety is extremely unlikely to be realised. It's about respect. It's about taking account of people's views and giving them the credibility that they're able to make an informed decision if you give them information in a form they can use. Well, I hope that we will see public engagement, public interaction built in as a key component of all major EU-wide funded projects. I think recognising that science is a public activity, it requires the support and legitimation of ultimate end users, of patients, of families and members of the public. They need to feel that they have a vested interest, a stake in the success of the outcome, and that they have a way of expressing their hopes as well as their concerns about the way forward. I think it was very important to do it now because we're just beginning to see the emergence of products for health applications which involve nanotechnology, and there has been a certain amount of adverse publicity, shroud waving by people who fear the potential consequences, the potential adverse consequences of nanotechnology will outweigh the benefits. I think doing the consultation now has revealed that there is considerable support once people know what the real issues are, and once they've been given an opportunity to appreciate those issues and make up their own mind about it. I think it will also be necessary to repeat the exercise at regular intervals as things develop and emerge, because one of the things that we know, as Niels Bohr so notably said, prediction is difficult, especially when it's about the future. Some of the things that we think might happen now will not happen because the science doesn't work that way. Some of the things we think will not happen may well become possible, and we will need to change our expectations, change our thinking, change the way in which we respond to and communicate with people's concerns in the light of new knowledge.